There's nothing more frustrating than doing everything right to track your blood pressure, but still getting a false reading. It can make you think your blood pressure is high when it's not, or even worse, make you think it's normal when it's actually too high. These false readings can mess with both your peace of mind and your health, because they can lead to the wrong treatment or no treatment at all when you really need it. In this video, we'll go over the common mistakes people make and how your blood pressure monitor itself could be giving you inaccurate readings. You'd be surprised how many people get inaccurate blood pressure readings just because of cuff size. Many experts agree, if your cuff's too small, your reading can appear higher than it really is. And if it's too big, it can make your numbers look lower than they should be. So how do you know if your cuff actually fits? Most cuffs have the size range printed right on them. Just grab a measuring tape, wrap it around the middle of your upper arm while it's relaxed and hanging down, and check if your arm measurement falls within that range. If it doesn't, it's best to get a cuff that fits properly, because using the wrong size can easily throw off your readings. In fact, the American College of Cardiology notes that a cuff that's too small can overestimate your top number, your systolic pressure, by as much as 20 points. The next reason you might be getting a false reading is if your cuff is too loose or too tight when you wrap it around your arm. Even if you're using the right size cuff, this simple mistake can still throw off your numbers. When you put the cuff on, it should feel snug, but not too tight. You should be able to slip 2 fingers between the cuff and your arm comfortably. If it's too loose and moves around, or so tight that you can't fit your fingers in, your reading probably won't be accurate. The next common mistake is putting the cuff in the wrong spot on your arm. The bottom edge of the cuff should sit just a little above the bend of your elbow, usually about half an inch to an inch of space. According to Welch Allen's official manual, the ideal distance is around 0.8 to 1.2 inches above the bend, while Omron, another major brand, recommends about half an inch or 1 to 2 centimeters. So if your cuff sits too close to your elbow or too high up your arm, your readings might not be accurate. Now, here's another important part: alignment. Most cuffs have a little artery marker printed on them. That marker should line up with the artery on the inside of your arm, and the air tube should run down along the inside of your forearm. This positioning helps the cuff detect your blood flow correctly, which gives you a more accurate reading. And don't forget about height. The cuff needs to be at the same level as your heart. If it's lower than your heart, especially when you're using a wrist monitor, your reading can come out higher than it really is. And if it's higher than your heart, your numbers may look lower than they should be. When you take your blood pressure, sit upright with your back supported, your feet flat on the floor, and your arm resting on a table or armrest. This way the cuff stays at the same level as your heart, giving you the most accurate reading. If you need to take your blood pressure while lying down, for example after surgery, or if you have a condition that makes sitting uncomfortable, just make sure the cuff stays level with your heart. Both the American Heart Association and Mayo Clinic recommend keeping the cuff at heart level to avoid mistakes. And one more important thing: after you change positions, like sitting down or lying back, give yourself a few minutes to relax before taking the reading. That short break helps your numbers come out more accurate. Another common mistake people make is wrapping the cuff over their clothing. No matter how thin your sleeve is, the cuff should always go directly on your bare skin, never over a shirt. Another big mistake is only taking your blood pressure once. The American College of Cardiology recommends taking 2 or 3 readings and then averaging them together. That way you cancel out any random errors and get a more accurate picture of your real blood pressure. You know, a lot of people don't realize that their blood pressure monitor might not always be perfectly accurate. That's why it's a good idea to bring your home monitor to your next doctor's visit and have them compare it with readings taken at the office. After that, bring it in about once a year, or as your doctor recommends, just to make sure it's still giving accurate readings. And if you're wondering which devices are the most reliable, you can check the link below for a list of recommended, validated blood pressure monitors. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.